about 70 years. You go into the Academy of Sciences in Washington, D.C. It's pretty impressive. They have carved in stone in the new building. On this side, they've got DNA, design of DNA. On this side, they have Darwin's finches. And right in front of you, as big as a billboard, is this. It's called the Keeling Curve. This is how important they think this is. The Keeling Curve is the CO2 level of planet Earth over the last 60 years or so. And it actually, the planet is respiring. It has to do with the amount of green cover in the northern hemisphere. It goes up in the winter and down in the summer, up, down. The trend is upward. Look what's happened just over the last 4 or 5 years. It continues up and up. Any health professional in this room, you know if your patient's retaining CO2, they're going to die. You have to turn that around. They went, the IPCC, actually collected real scientific measurements around the world for the last 150 years of the temperature. Here's the trend of temperature over the last 150 years worldwide. Here's the trend of temperature over the last 100 years. Here's the trend of temperature over my lifetime. And here's the trend of temperature over my son's lifetime. Any doctor that was seeing a patient retaining CO2 with a fever that's going spiking up like this didn't pay attention. Really. So I think there's a huge urgency to reduce our CO2 loading, but also to begin to prepare for profound changes in our weather, sea level rise, and the rest. The ground has gotten hotter. It's making crops and other things more difficult. The water has gotten warmer. It means the storms become much more violent, and the oceans have become much more acid, which has major impacts on the species. It becomes acid because CO2 dissolves in it. So where do we go from here? This is the most recognized structure floated by the AIA about 2 years ago in America at this point. It was built during the Great Depression. This is the workhorse bridge of America, carries probably more weight than any other bridge in the United States. The George Washington Bridge built during the Depression. In my opinion, the most beautiful bridge in America, built during the Great Depression. Workhorse Bridge of San Francisco, built during the Great Depression. The dam that helped create Las Vegas and helped get Los Angeles going, built during the Great Depression. And the dam that helped win World War II because of the electricity production of the Grand Coulee, built during the Great Depression. Obviously, where I'm going with this, we're going to have to do a lot of infrastructure investment very soon. And either we figure out ways to do infrastructure investment that gives us a bunch of short-term fixes, or we figure out something that Frederick Law Olmsted understood all along, which is you got to try and fix the environmental need, the economic need, and the human need at the same time, rather than fragment them out the way we've been doing it. So we're on the threshold of a lot of building. Skip this. So why didn't I put this slide in? It's a picture of doctors selling cigarettes in 1955. It's totally laughable that this would happen. In 63, the Surgeon General told people not to smoke. And we did this one person at a time thing. Oh, stop smoking. It didn't really work. It took the social changes that we had to put in place to make it happen. Here's smoking declining from 1986 in the United States and in California to 2003, 2004. Things that had to happen. And this is going to relate to the solutions for our built environment issues. We had to tax things we didn't want people to do. Smoking. We made cigarettes expensive. We used some of that money to then do anti-tobacco advertising, to demonize the tobacco industry. It really worked. And the other thing we had to do was put in place environmental laws. You can't smoke in here. And did it work? How many of you have, now I want to ask, because everyone my age has lost a friend or a loved one to lung cancer and tobacco-related diseases. Look what happened to cancer in California just by getting it down to 44 back. We've accumulated the benefits very, very rapidly. But the whole country has simply done what California had done in reducing smoking. We'd be saving about 30,000 lives a year just from tobacco. We've got to change the American diet. And so we've got to stop eating like Northern European farmers and start eating like Southeast Asians with lots of fruits and vegetables and oil being used as a condiment, but not the major source. And this Dr. Walt Willett has been working with the CIA to change the diet. And the CIA has trained 10,000 chefs a year to go out and begin to have people eat healthy diets. The CIA is the Culinary Institute of America. They were the CIA before the CIA was the CIA. But this is the major cooking school in the United States. We've got to, this is my, I always post, my wife posts my Secret Service picture where I'm protecting Governor Schwarzenegger. This is an event where we were essentially arguing that if we're going to do price supports, we ought to be doing price supports on subsidies on food that's good for people and not simply for commodity foods that a large extent go to CAFOs, to animal feeding operations. We need to demonize bad food. Bad food spelled backwards is doof. So everybody in America needs to know that if you eat doof, you are a doofus. This is what they have done in Europe or in England. I love this one about bad food there. And we need to tax high fructose corn sugar. If we tax 1 cent, you'd hardly even notice it, 1 cent per teaspoon of high fructose corn sugar, we would generate $18 billion a year. And I would not spend that on medical care. I would spend it on kids, because if you really want to intervene, you've got to start with the children. And so if you want to start with kids, I'd require every school to have a school garden, and I'd help pay for that. I'd require that every child be able to walk or bike safely to school and put safe routes to school programs. I'd require that we really reinstate the cafeterias, because a lot of kids are eating standing up because they don't have decent cafeteria space, and kids don't eat sensible food when they're sitting up. And by the way, we need to put recess before lunch, because kids actually behave and eat better if they run around a bit before lunch. We need to teach nutrition, not just to the kids, but to the teachers, because a lot of them don't know it either. We need to put PE programs back in place, and we need to do a bunch of other things. But let's focus on the children. Lots of people say we're just going to pay for diabetes. That's about 2 weeks worth of diabetes. We're not going to do much about that. We need to do everything we can to make it easier for people to walk. 10,000 steps a day. You take people who are pre-diabetic and they do 10,000 steps a day for 6 months, you reduce their risk of becoming diabetic by about 60%. By the way, I'm talking about type 2 adult onset diabetes, not type 1. As we get older, the exercise we all revert to is walking. It has the fewest complications and the greatest benefits. And you've got it. So having a place to safely walk is not nice. It's a matter of life and death, and especially for our elderly. By the way, joint function, muscle function, and balance are extraordinarily important in that whole process. So I gave a talk to the American Institute of Architects a few years ago, and I said, and I want you architects to build buildings so when you walk in, the first thing you see is a pleasant and attractive stairway. You shouldn't have to go look for a stairway off in a corner, and they're kind of scary and everything else. And by the way, if you do 1 flight of stairs a day for a whole year, you've lost a pound of body weight, you've burned it off. People should take the stairs. I was really afraid after I left that they would come up to me and say, Doc, you don't know what the hell you're talking about. And they came up and said, Doc, we love stairs. You can really make nice buildings if you have stairs. And all this, layer plate buildings are just not much fun. So the head of the AIA put stairs in his office, and he was just thrilled with how they came out in terms of both the physical use, but also the social beauty, the social aspects and the beauty of them as well. Kaiser Permanente, one of the healthcare plans in California, took this to an extreme. They actually were arguing that we ought to get rid of all safety standards whatsoever and have people walk up and down in high heels. Without railing, right? That's a joke, but to be building buildings without, skylights. I don't know. In your state now, do you require under code 6% skylight cover on all new buildings? All the new Walmart and Safeway's big box buildings have 6% skylights because you have huge energy savings by doing that. You have to control heat and everything else, but the daylighting is so powerful. Kids learn better in daylit classrooms. When did we ever decide that kids would learn better in a box with buzzing fluorescent lights over their head? Children actually learn better in daylight. By the way, daylight with a better spectrum, the kids are more alert, their serotonin levels go up, the antidepressant hormone goes up, and the melatonin levels, the sleep hormone, goes down with full spectrum daylight in the classroom. And by the way, it's cheap. I mean, if God's sending us photons to the roof of the building and we're burning fossil fuels, what bigger nonsense could there be? And kids, by the way, do better in math and reading and all the rest. Kids need to walk and bike safely to school. It's not simply that it's better exercise, they actually do better in school. They behave better, they learn better with that little bit of exercise built into the day. You need to put safe routes to schools in place. In places that, this is Marin County, but basically walking and biking went from 40% to 60% simply by putting the program in place and doing a bit of marketing to the school, the PTA, and the rest. Everybody ought to be within a quarter mile of a park. And it's pretty outrageous, but in LA, for example, we've got parts of the city where there's 1 acre to about 100 people of park, and other parts where there are 3,000 people to 1 acre of park. And it ought to be an essential determinant of life. Parks, by the way, decrease the temperature about 4 degrees Celsius as you put them in neighborhoods. So that's an air pollution benefit by having green space in parks as well. We ought to be planting trees. One of the problems we're having in LA is the LAPD, Los Angeles Police Department, has decided they don't like trees. Why don't you like trees? Because the perps hide under them when we're flying around in a helicopter. We can't see them. I'm not joking. So we're sort of dealing with the LAPD right now. It is leading agricultural county in the United States in 1945 in value and production was Los Angeles. Imagine Los Angeles. Now we've taken that huge, spectacular cropland and turned it into, 1-story and 2-story buildings and impervious surfaces. And we need to reconvert our city. I'm shooting a video PBS special for 2 hours. We were in Detroit a couple of weeks ago, and it's remarkable how much open space now is in Detroit. And it's going back to prairie, but it's crazy not to be growing a really diverse agriculture right close to where people live. And how do we create local activity? Every school ought to have a garden. Kids ought to know where food comes from. The White House now has a garden, thanks in part to Michael Pollan, and of course Michelle put it in place. When I was health officer, I argued that every community ought to have a farmer's market. And everybody said, well, that's kind of tangential. Why don't you? Because especially in our poor communities, you can't buy decent food. The only way you do it. And there's a huge battle about how you get whip cards and food stamps being used in the farmers markets, but it's really a public health importance to have that available. By the way, they always say farmers markets are for rich people, and it's true. Between about 9 and 11 in the morning, they're for rich people. And then all that stuff is just as nutritious at 1 o'clock, but it's a lot cheaper. And so poor people know that that's the time to go. We need to build buildings, and David was showing me his building of very high energy efficiency. It's crazy to be wasting electricity if you're not building high efficiency buildings. This is from an article where this guy was in Berkeley, but you need to have very good quality heat exchangers if you're going to do this. Last time we sealed up buildings, it was a health disaster. If we seal them up, we're going to have high quality heat exchangers and air changes in those buildings. And I want to thank Danny Samuels for these pictures of what's going on here in Houston. Rick Lowe has been leading Project Rope Houses here in Houston. There's a lot of times we played a lot of card games and other things sitting on these second floor porches because it was cooler than downstairs. It was a pretty fun place to live. This high efficiency solar house is going to be put on a truck and taken to Washington, D.C. in October, and will compete with about 20 other buildings. So you got to root for the local kids here at Rice to see if they can win the solar decathlon this fall. Skip these. I'm really proud of this one. So I'm a pediatrician, and 2 years ago, pediatricians write prescriptions for the country, we're going to change this medication for coughs and this protection. Kids ought to be in car seats, and kids shouldn't be stuck with junk advertising on TV. Well, this is the new prescription for what kind of neighborhood children should grow up in. And what it essentially says is children ought to grow up in neighborhoods that enable them to have increasing autonomy, increasing physical activity, increasing engagement in the world. It's the first time in the history of, I think, medical practice that this is 70,000 pediatricians writing a prescription of what kind of neighborhood kids ought to grow up in. And by the way, this is the stuff that you do already. It's just now it's doctor's orders. When I started talking about this 10 years ago, there were no papers being reporting land use and health at the national meeting of the American Public Health Association, 03 by 05. There were 55 studies going on, 82 studies or reports coming out in 08. I have to stop my class at a moment because young people are so interested in a discipline that is an overlap between health. It's basically the group we just talked about. How many of you are from environment? How many of you are from health? How many of you are from design and architecture? And this is really interesting. This is stuff that Frederick Law Olmsted would understand in 1 minute. And so there's a real outpouring of interest. And in part, it's a rebellion of our young people who they don't want to feel helpless in the face of economic, social, and environmental perfect storms. I'm going to skip these. I just love this one. Astonishing news from Men's Health. We talk about sex secrets of an erotic marriage. Now, this is Dan Burton's article. I love the fact that this covered Men's Health on the redesign of streets with walkability and green space and how they all look. And this is a big deal because this is a transition from taking something amongst, if you will, an elite and a specialized interest group and bringing it down to every person to understand that the streets and neighborhoods ought to look like this. If you build bike routes, people use them. The more bike routes that Portland puts in place, the more traffic jams they have on the bike routes because so many people are using them. The secret of bike routes, by the way, is they have to have a destination at each end. Where I lived in California, the bike route would stop about a half mile from the BART stop. You know, so we need to rehab old schools. It's actually cheaper to rehab old schools than build new ones, and it's terrible to be tearing down these wonderful civic structures, or more likely turning them into condominiums. We have a law in California now that all new streets will be complete streets, and all rehab streets will be complete streets. I'm going to skip these, skip this, skip this. So I'm working on this PBS special, and my directors and producers, Harry Weiland and Dale Bell, were here in town doing a shoot about 6 months ago for one of the health studies they did. They did a series called Eden's Lost and Found. They did one on Chicago, one on Seattle, one on Los Angeles. Really quite interesting, and this is the one we're shooting, and I don't like that picture of me, but we're shooting it, and it will air a 2-hour special on how the built environment influences people's health. And my goal here is that this has to become normative knowledge of the average American. I need to be in a neighborhood where I can go to walk, where my kids can go out the door and have autonomy the way I did when I was a kid. And in fact, my producers, I was in Atlanta for 3 days earlier this week. We were interviewing kids in Smyrna, Georgia. We thought the interview would go on for about an hour and a half. These are teenagers. It went on for 4 hours. And once they started ventilating the fact that they hated living in a place at age 14, 15, and 16, and not being able to go somewhere without asking their parents to put them in the car. They had no autonomy about going to the library, the beach, a date, or anything else. I actually think our new president, there is a chance that we will begin to take on many of these issues, and here's the president's plank. We must examine all policies, including ag, education, and environmental health, to assess and improving the effects on health. So, remember our 5th grader? Well, he moves to a neighborhood that's walkable and bikeable, and he starts to walk and bicycle to school 1 mile 4 days a week. 30-minute walking or bicycle ride is about 125 calories. He does this 4 days a week, and that's 40,000 calories in a year. That's 11 pounds of body fat. So 2 years after his doctor's appointment, having moved to Houston's wonderful, newly designed community where kids can walk and bike, he goes back to his doctor, and he's gaining 4 inches because that's what he would grow during the 2 years. His weight is down to the 65th percentile. It's not perfect, but it's a lot better than the 95th percentile, but his blood pressure's come down. It's absolutely predictable. Blood sugar's come down, his cholesterol's normal, his energy level and mood are really good. He's got a girlfriend. His dad is saving money on the car and the gasoline. The planet's saving CO2. And he lives happily ever after because he's moved to a neighborhood that he can walk and bike in. So I'm having fun with this, but you get the message. We can either design things that make people add to their health, or we can design things that undermine that. So with that, let me stop. Well, people should say the names if you don't mind.
Zane Siegel. I was in Copenhagen a couple of weeks ago. You mentioned Copenhagen. And I think the cab driver told us as we were driving in, or maybe someone in the hotel, said that they had made a conscious decision to add bike lanes and to totally reconfigure the city to reduce the cars, increase the pedestrians, and definitely increase the bicycles. And there, the bicycle lanes were amazing. They were one way on both sides of the street, about 8 feet wide. They had their own turn signals. They could turn left against traffic with arrows. They were treated absolutely as their own brand of vehicle, and they really had supersedence over everybody. And I was afraid to get on a bike because there were so many bikes.
In Amsterdam, you could, I don't remember, you put a kroner or something in the little machine, and you'd get the bike, and you'd bicycle all around, and you put the bike back in the thing, and you get your kroner back, or whatever it was called. And you know what was cool is when I'm biking around, I didn't feel like a tourist. I felt like I was part of the community.
I'm Tamara, and I have a friend who just purchased a house. I tried to stop her, but she just purchased a house. You don't know Houston, up 288 past Beltway, in one of those suburb communities that looks like the cul-de-sacs. In fact, she's on the cul-de-sac, so if she has a child will have to either hop fences or get driven around. And what I'm wondering is there are so many of these suburban communities that are out there. Is there some kind of suburban retrofit prescription that can be done? Because there are so many of these places that, and unless the economy completely falls out and we bulldoze these communities, they're there, people live there, they bought because they can afford to live there, and that's why they bought the house. What can we do with these cul-de-sac suburbs to turn them into places that are healthy for people to live? Can this be done? And are architects and designers working on plans for this?
What a terrific question. Tamara, number one, there is a terrific guy named Fred Kent at Partnership for Public Places, and I've gone with him to some of the mayor's institutes where the mayors will sit there and they'll bring in the map of their city and say, I've got this downtown area, I've got this area out here with a dead mall and a school we're going to have to give up on, and I've got to turn it into something interesting. And he will do the drawings, and it's just amazing to watch. Because you want to minimize the costs as you're doing this. There's a book out right now by Ellen Dunham Jones and June Williamson called Retrofitting Suburbia. And this issue of dead malls, and there's actually a website called Dead Malls that's worth looking at. One of the ones, we were shooting one in Atlanta when we were there, and there's thought about, it actually is a pretty good location for creating a new neighborhood school, because they were put there in part because they're pretty accessible. So I think we're going to be reinventing a lot of this. I'm a little disappointed that the Main Street hasn't brought in quite as much business and shopping. It's such a lovely thing to walk along downtown here. It's certainly done well in lots of other cities. I was in Aiken, South Carolina at my brother's recently, and that downtown has become quite delightful. One of the things for downtowns is putting cafe tables out. I know it's hot here, but at least in the evening it's pleasant to sit out, and creating spaces which also are also safer. I don't think we can solve all of it, but there's a lot we can do. The other thing you can do about some of the suburbia, and it's probably impossible now that it's built, but they should have required when it was built at the end of the cul-de-sac to at least have a pass-through to the next street so the child doesn't have to go through. There's probably a technical planning term for that, a walking right-of-way or a bicycle right-of-way or a people way through it. The owners tend to resist it because they're afraid bad people will use them, even though the density is not such that we would have very many bad people doing it. In fact, when my kids were little, we were living in the Berkeley area, and all the Berkeley Hills were filled with these sidewalks. We had so much fun when we were 4 and 5, so we'd discover some new route to get up to this little park that they would play in. And they still talk about how much fun they had doing that. And it was good exercise for me, too.
Hi, good evening. My name is Maggie. I'm from Atascocita, one of the suburban areas in the northeast part of Houston. And I just wanted to share what happened to our neighborhood just after Hurricane Ike last year. We were without power for almost 2 weeks, 13 days. And some of my friends that lived in Kingwood, which is the livable forest up there, decided to start having fun with it. It's all your attitude, how you have the kids respond to it. The kids had the most fun in those 2 weeks than they had in their entire life. Because they got out, they met all of the neighborhood kids in their cul-de-sac. It was playtime. And everybody, got rid of all their meat and the freezer, one neighbor each night of the week, and barbecued. And now they're doing it once a month. They're going to have a no electricity night.
Gma, can we have another hurricane? Thank you very much.
Hi, I'm Alicia Murray, and I wanted to know what can be put in place to educate the community, because I think that's the bottom line of this, no matter what is put in place. And my horror story is I have a cousin who is like 230 pounds, and she smokes, and her husband is overweight, and he's diabetic, and she's a registered nurse in Indiana. She's not alone. I go by her in Indiana, there's a bunch of people smoking and grossly overweight. And her daughter, which really concerns me that recently, is at least 230 pounds. And she's about to finish school in forensic science. And this is a horror when I look at it. I don't see her life moving as smoothly as her mother's because of everything that's in place now. But the mindset, their mindset of what they think is important, they live in an area that's another suburban area off I-10 and Federal Road, if anybody knows where that is. So it's a chemical environment. There's no walking. The kids don't do anything. Her poor son is like frantic about getting overweight. So he goes 24 hours. So he's like trying to keep himself. But what do you do about changing the ideas of people? Because she thinks this is all right, and I have a problem with that, so I'm out that.
Wow. I'm really sorry to hear. I mean, this is frightening, and it's extremely hard to turn this kind of thing around. And I sort of halfway said the good news when I said we've got to focus on the children. The reality, and every doc knows this, every doc is taking care of lots and lots of alcoholics and addicts and people that are in a life pattern when they get in their 50s and 60s, and trying to turn them around is almost impossible. They've done so much damage to themselves. And so maybe it's just the pediatrician in me focusing on the next generation is going to be really important, number one. Number two, that hospital has an obligation to really put in place fitness programs, and you can incentivize people. You can do nicotine. And what works is, by the way, to do a bonus that if we don't find cocaine in your urine, a nicotine byproduct, for a month or 6 months, you'll get a $500 bonus. And Washoe County near Reno has put a system in place where every time your card is swished at the local exercise place, you get a bonus on your paycheck. By the way, the insurance costs of having people like this are so huge. These costs are relatively trivial by comparison. What's interesting is what they told me is that in the beginning people would go and use the swipe card at the gym and then go sit down and not do anything. But what happened over time is they actually got up and people would do outreach to them and began to engage in the activity. Maybe it would be the pool in the beginning or yoga or something else. But there have to be system incentives put in place for people to do the right thing. I don't know what kind of hospital allows people to smoke outside the doors. I mean, it's really disgraceful.
It has put things in place. I have to say that I'm familiar with the HR department, so there are things in place. Their fear is forcing people to do things because they have patients as well that they allow. They have patients as well as that they allow to smoke outside. They've now put ordinance that you can't smoke within so many feet, but there's nothing to enforce that. So if they find you smoking, there's nothing in place to prevent that. It concerns me because she's a healthcare professional and has been for some years.
You know, the CDC is a tobacco-free campus. Lots of hospitals are becoming tobacco-free campuses. I'm not suggesting, well, I am suggesting that at some point, you know, you incentivize some behaviors and disincentivize it. Your insurance is paying for her misery. My insurance is helping pay for her misery. And I'm sorry, it's sort of like people on motorcycles saying, I've got a right to ride around with a helmet. We ought to have, yeah, you have a right to ride around with a helmet, but then we shouldn't have an obligation to pay for your health care when you stop walking. Last question or two.
Thanks for coming all the way back here. Hi, I'm Amanda Edwards, and my question to you, I saw a lot of pictures in your slideshow with Governor Schwarzenegger. Okay, one picture. But my question is, how can we start on a local level in terms of policy, in terms of local policies, city policies, that can help to spur that type of healthy lifestyle and a movement toward a healthy lifestyle? I understand you can have campaigns, citywide campaigns for health and fitness, but other than that, what are some other ideas?
Good question. And probably, you know, I know people go off and do blood pressure screenings and all this sort of thing. One is, I do think embedded agriculture in communities is a way of generating meaningful work, meaningful income for communities. It is exercise. I visited the community garden near your office today, David. They ought to be producing some more food, and there are ways that one can do that. One of the things we've done is every county in California health department has one. In LA, it's about 18 staff who are, their primary job is to interface with the planning agency and to speak up on every single planning decision. And a year ago or so, where they were doing this and going, wait a minute, how do the kids get to school here, and how does that shopping center, or how does this work for the well-being of the community? In the beginning, people thought that was a crazy idea. The planning commissioners now have begun to adopt it. We would very much like to put in place a requirement for a health impact assessment. I mean, it's fine that we do an impact assessment for bunnies and birds and stuff, but we ought to be doing an impact assessment on old people and young people when we're putting in place a proposed development. I think there are things we could do with the insurance, the mortgage insurance industry to incentivize certain kinds of developments and disincentivize others. In fact, a lot of the mortgage money comes out of insurance companies, and insurance companies may be malleable as well. Local interventions, the menu labeling in fast food places would not have succeeded at the state level except it was shown to work at the county level. Tobacco-free restaurants would not have succeeded at the state level except it was shown to work at many of the local jurisdictions. Getting rid of junk food in schools was a totally crazy idea 8 years ago, and when it was shown the schools actually did not lose money in a lot of the fundraising programs by getting rid of junk food, they were able to get rid of it now statewide. So, yeah, you got to have the big shot doing it, but ultimately, studies at a locality with Well, this is a big takeaway. With evaluation. You have to do it, and then you have to quantify it. You have to work with people that know how to turn that into real data and a real message, because then you can go forward in the policy arena and say, no, we're not just waving our hands. The kids lost 3 pounds on average. The school did not lose any money, and this is the right thing to do, blah, blah, blah. So, but your challenge is exactly right. This has got to be top down, and it's got to be bottom up, but it's got to be both. Why don't you yell it out?
Yeah, well, I've been just thinking about this a lot lately, because I know how critical the situation is in, the United States, the world, and so forth, about change, how much change we have to go through and so forth. And I'm a big fan of polishing and reinforcing, doing things in a positive way, but I keep thinking this idea we've got so much to do. Should be thinking about putting together some sort of thing about crimes against humanity, publicizing those people that are doing crimes against humanity. Because there's so much going on. I mean, we've got on the media and everything else, there's so much going on. I just wonder if that might be a way. It's just a thought on that. If there's something that we could be done in that regard. Because clearly, we got to do something, we got to do quick.
You know, Mary, I'm not going to go too deeply into what you said, but about 3 or 4 years ago, I became convinced that climate change was the most important health threat facing humanity, which is a pretty extreme statement. So I spent the next 6 months to a year learning more and more about climate change. In medicine, the more you learn about meningitis or lymphosarcoma or some god-awful disease, you actually become comfortable with it. You use a vocabulary, you get accustomed to the whole thing. Well, we can do this, blah, blah, blah. This is the first time in my life, the more I studied it, the more scared I became, the more worried I became. And the numbers I'm reading on climate change, without exaggeration, we're talking as many as 500 million deaths worldwide over some period of time. Basically, the Ganges and the Brahmaputra rivers dry up because all the snow is gone from the Himalayas. We're talking, and sea level rise, 180 million Bangladeshis are on their last legs. And that's just the beginning of the impacts in many portions of the world. Americans think, well, we'll just move further north and everything will be fine. Canadians aren't going to want us, by the way. But that's another story. But this is one of the deepest issues, and it's very hard politically to get America to pay attention to something that isn't right in our face and urgent.
Good evening, Joel Salazar, a lawyer here in town. Obvious question: why does the right wing, our conservatives, they are so disbelieving on the concept of climate change and think it's a farce?
One is, it's kind of easy to make fun of because it's distant. 2, I'll just tell a right-wing story. So I go on this radio show, and this red-faced, tobacco-smelling, overfed white guy who was addicted to OxyContin challenges me and says to me, oh, you're from the government, you must be corrupt, lazy, or stupid. I mean, he literally said this to me. And I said, no, I'm not corrupt. I'm not lazy. But I've worked very hard to understand what's going on, and I continually feel like there's more I need to know. So people that feel like they can solve absolutely everything by talking to themselves and their own common sense and their own experiences that they internalize between ages 3 and 6 are going to solve all the world's problems. It's not a very practical way to run the world. And I don't have any other answer. I think at the core, if you think God's going to fix all of our problems, you're going to end up like the folks in Easter Island starving to death and civilization collapses. It isn't because God doesn't love us. God loves us, but God doesn't expect us to be stupid. And that's what we need to do. I'm going to stop there. Thank you very much.
So want to, on that note, go look at the HoustonTomorrow.org website, where I think our front page story right now is about a climate change report that came out the day before yesterday, and has a huge section on the Gulf Coast and what we can expect. 100,000 houses lost just to sea level rise. Days like today, which was brutal, are now 60 days a year, something like that. In Houston, we can expect them to be 165 days every year, pretty soon. So change is really coming very fast, and it's here. It's not off in 2050 or 3000 or something like that. It's here now. And we're going to have crop issues, we're going to have food issues. There's a picture of Indiana moving down from Indiana to Texas, showing that its temperature and climate will be just like it is here in Houston in a few years. So there's a lot of work to do. One, to slow that down as much as we can, and to change our behavior enough to just bring those carbon dioxide levels down. And two, to figure out how to live in it. So we're working on that, and it's a lot, and everything Dick talks. The interesting thing here, I think, is that everything Dick's talking about, and everything we talk about as being solutions to this problem or that problem, actually turn out to be solutions to all the problems. So you can see this perfect storm. You can see how it all works as a perfect storm of solution as well, and we really have to be serious about it. And I think the notion of failure of leadership is something we've suffered enormously here in Houston, and we need to fix that. We elect our leaders. So, thank you all for coming, and thanks, Dick, for coming here and talking to us and giving us all this depressing news.